Okay, here's why you cannot trust public health right now. In 2017, the EPA fired half their scientific advisory boards and approved Wolbachia-infected mosquito releases in 4 U.S. states. Now, this is very key because it was removed from assays, so doctors don't even know how to test for it. I did write the Canadian government in 2016. I heard from Dominic LeBlanc. Here you go, 2017. He passed it on to Jane Philpott. I never heard from Jane Philpott. I wrote Dr. Tam. She ignored it completely. Here's where you're being lied to. Dr. Tam lied and said it's a very novel virus. We don't understand the immunology of this virus very much. Well, that's a lie because Dr. Alison McGeer worked on it with the WHO. And that was taken right from the Mount Sinai Hospital staff directory. And Theresa Tam has ties to the WHO. Now, the thing about coronavirus is it's widespread in nature. It's been known over 50 years. June Amilda discovered it. It's in birds, like bulbuls, just like Zika is. It's in the same phylogenetic tree or the classification of flaviviruses. Now, the thing you don't know about flaviviruses is that the more exposure you get to these viruses, the worse you get. So the last thing you want to do is a vaccine. ADE is what it's called, antibody-dependent enhancement. Here's Dr. Tam's response. She totally ignored it, denied that Kulix were a vector of Zika. Well, they are. 5 other teams have since confirmed Dr. Ayer's results. And for those of you who think, Wolbachia, what's that? Well, Dr. War says, I can't make heads or tails of Wolbachia. Really? It's in the same class as those that cause typhoid. And I'm taking this right from New York Health Department's board here. So boil water advisory should be 20 minutes. The CDC says boil water for 1 minute. Halton Region says boil water for 1 minute. These were established guidelines decades ago. There again, you cannot trust public health. Now, in 2017, I discovered this paper that actually Wolbachia kind of teams up with E. coli. Well, E. coli is in runoff water off farms and so on. So that's like a double dose of gram-negative. Now, I was looking up, why are people in their 30s losing an eye and a liver in the United States? And lo and behold, I find a paper here that the researchers determined that species identification was missing in rickettsia. Well, Wolbachia pipientis falls under that. And this gent went from legally blind to 20/20 with the proper treatment. The proper treatment is Dr. Conover's class of antibiotics. May he rest in peace, because his work would save millions of lives. Well, we have doctors pushing hydroxychloroquine, which is known to cause irreversible eye damage, heart, and kidney damage. And here's your proof. It can be grown at 37 degrees C. This was determined in 2003. And a submission about Ozotec. You're going to hear, oh, Ozotec is to blame. Well, Ozotec used 2 well-defined genes in their modification. I'm not keen on any of this modification personally, but they are the scapegoat for what Wolbachia is doing. Wolbachia is deemed, oh, it's in nature, it's natural. Well, so is snake venom, right? So here you go. Gary Carr, Halton Region, he blocked me when I let him know, hey, water boil should be 20 minutes. They were 5 minutes in the 90s when I studied nursing. And issued by the medical officer of health. Well, look at that, no name. No one's held accountable. And I got canned answers from Public Health Ontario about the ticks submitted because they only test black-legged ticks, not brown-legged ticks. The WHO is getting desperate, obviously, because they've unveiled Florence the robot to give you reliable information, programmed by who? Tedros is not a physician. He's a malaria researcher. Now, Dr. Eric Ding from Harvard, and Harvard, by the way, is the one that's releasing these balloon things that carry so-called calcium carbonate. Well, guess what? They have the gene, the Wolbachia gene in them. So isn't that interesting? I asked Eric Ding, what cell is this replicating inside of the coronavirus? Well, I never get an answer, even though the Federation of American Scientists say, ask us anything. They haven't answered me. Now, Landon Getz actually, he's been saying the same things. Exaggerated claims of preprints. And he said, hydroxychloroquine was touted as a miracle cure, but has led to people self-medicating with fatal consequences. Well, that means people are dying, and they really are. And there's plenty of literature that shows the cross enhancements, the ADE, and I'm not taking this out of the air. Dr. Halsted has talked about it, Vincent Ranciello, PhD. These are reputable, old school scientists. I want to just remind you here with this screenshot that a vaccine could be made available as early as 2018. This was in the New York Times when Zika was around. Remember Zika? Remember that? Yeah, well, it takes 10 to 15 years for a vaccine to become available that's safe. But Bill Gates has some pretty wild ideas. Now, he has no background in healthcare. So how did he get to this position? I don't know. And Rocco Gelati, I hope I say his name right, he has told us that we've given $1 billion to Bill Gates already of our money. Here again is the early release mRNA vaccine that shows an increase in severe adverse events. This is in the yellow here, including neurological ones. Well, that's kind of like ADE. The more you get of this, the worse you get, not the better. And I suspect with plasma, it'll be the same thing. You're getting antibodies from someone. Now, you may say, well, wait a minute. Pathologists are saying no one's died from it. You're right. They're probably dying from the secondary infection. And as I showed you with that screenshot with Eric Ding there, never answered me, it's 75% of the lethal shock is caused by gram-negative bacteria. That fits with Wolbachia. So most of what kills you is the secondary infection. Now I want to show this here because Brazil, there's a whole lot of Wolbachia releases going on there. New York State. And these are the places, as you can see, where people are dying. I have tried many times to knock on the doors of people in ophthalmology since I worked in ophthalmology about 7 years, but I get blocked and completely ignored. Private equity, what they've done is they've been clever to make sure that Wolbachia is not on assays and to just take away any studies they don't like, right? No reason given. So doctors don't even know how to test for it. Now, I just want to remind you what prompted me was the rate of uveal melanoma was only 6 per 1 million. In Alabama, they had 83.5 times that national average. So I knew there was something going on here. Now, with this COVID test, it makes no sense that a virus you can breathe in, you test for, you don't have it, you could breathe it in another 2 seconds. So these tests are crazy. But what I did figure out from looking at what they're doing with organ transplants and harvesting of organs overseas is that you swab mucous membranes, you get a good DNA sample. So what I think is going on with this, this testing and this passport and this, you've got to stay 2 meters away, is there's this type of surveillance keeping track of people that might be really good organ matches. And in 5 years, your teenager might be put in an auditorium saying, look, we've got half these people that need a kidney and half these people need this. So let's see who matches. We can get your consent to see if you match. And then maybe you'll give up an organ. Maybe you'll give up a kidney. And it won't be done maybe criminally, or maybe it will, but it'll be done by guilt trip. Like your best friend needs a kidney, why won't you give it to him? So this has become really sick. And the reason I know this is looking at what's going on in China and Taiwan, and there's no registry, there's no waiting list, it's all compartmentalized, and the surgeons don't even know where the organs come from. So this is a very clever way to have the right hand not know what the left hand's doing. There again, I just want to show you that Gary Carr, just completely ignore me. Now, top epidemiologists say no masks. Masks never happened with SARS. I worked SARS frontline. We didn't do masks. So I think that's more about gagging people. Over 400 Madrid doctors have found no scientific basis. Oh yes, I do know there's this list of somebody who's compiled that say masks are helpful. Yeah, you look at the references, it's the WHO, the UN, it's all self-citations basically. There's no real science behind it. Now, thankfully, the Brussels Times published this, that there are plaintiffs seeking £10,000 per day for each day of this lockdown. And a second criminal complaint is coming against the Belgian state, Belgian virologist Bill Gates, and British epidemiologist Dr. Neil Ferguson. So do you really want to be on that list, doctors here? Now, I was appalled when I saw the Halton video about having masks and staying informed with this COVID app. I highly recommend you do none of this and keep your kids home until this whole thing is declared off. Masking children is akin to child abuse. We don't know what's going on. They were talking about supervised bathroom visits. Supervised bathroom visits to keep 2 meters apart. What's going on there? We're not doing that. Okay? 120% of sexual assaults happen in these unsafe spaces, these shared spaces where anyone can waltz in and on your kid. So we're not doing this. So I read over, and a hard no. They're trying to say, oh, public health will be notified, or the school will be contacted by public health, this anonymous public health that's giving dangerous advice in the event of contact tracing related to confirmed COVID case. Well, there is no such thing as a confirmed COVID case because this testing doesn't test for free infectious viruses. The Nobel Prize winner that invented it confirmed that, the person that invented it. So don't let Bill Gates or some billionaire or some department head tell you otherwise. This is an egregious, shameful abuse of power that will probably lead to a database of your kids' private information being hacked, an organ match being made, and maybe something worse. So Life Labs has already blocked investigations from being made public and has violated 15 million Canadians. So this has to stop. The whole darn thing has to stop. Now here's my map where I figured out what's going on in Taiwan is now over here. And they're doing the same stuff to humans over here now. They're trying. We're not doing it. We have a cure. Here's, we have doxycycline. We have Dr. Cunningham class that works on Wolbachia. They just have to put it back on assays. And DDT would probably cut it off at the core. Now, I'll leave you with this. You should follow Rocco on Twitter. Again, why is Bill Gates, orchestrating a meeting of 400 elected mayors? Trudeau has already given $1 billion to Bill Gates of our money, $1 billion. So this has to stop.